Here is exactly how the NCLEX-RN works and how to pass it in a few minutes. The NCLEX-RN is the licensing exam every new registered nurse in the United States must pass. It is written by the National Council of State Boards of Nursing, and you take it on a computer at a VIEW test center. It is a computerized adaptive test. The computer chooses your next question based on how you answered the last one. Answer correctly, and the next item is harder. Answer incorrectly, and it is easier. The whole time, it is narrowing in on your true ability level. So there is no fixed question count. You answer a minimum of 85 items and a maximum of 150 in 5 hours total, including every break. Now the part almost everyone gets wrong. There is no percentage score. You do not need 75% or any percent. The computer stops as soon as it is 95% certain your ability is clearly above or clearly below the passing standard, which means a short exam is not a bad sign. You can pass at 85 items, and you can fail at 85 items. Exam length tells you nothing about your result. On a minimum length exam, 52 items come from the content areas, 18 are 3 clinical judgment case studies of 6 questions each, and the last 15 are unscored pretest items. You cannot tell which are which, so treat every question as if it counts. The content comes from 4 client needs categories, split into 8 areas, and they are not weighted equally. Study where the points are. The 3 heaviest: management of care, 15 to 21%, pharmacological and parenteral therapies, 13 to 19%, physiological adaptation, 11 to 17%, then safety and infection prevention and control, 10 to 16, reduction of risk potential, 9 to 15. And health promotion, psychosocial integrity, and basic care and comfort, 6 to 12% each. Management of care plus pharmacology is roughly a third of your exam, and almost none of it is recall. The NCLEX tests clinical judgment. Who do you see first? What do you do next? What do you hold? 3 real questions. First, which task can you delegate to unlicensed assistive personnel? Measuring vital signs on a stable client scheduled for discharge. Assessment, teaching, and evaluation stay with the nurse. Second, for clients and report. Who do you assess first? The one with new onset stridor and increasing respiratory effort. Airway before breathing, breathing before circulation, and all 3 before pain or anxiety. Third, before giving digoxin, you count an apical pulse of 54. Hold the dose and notify the provider. Digoxin slows the heart, so in an adult you hold below 60. So how do you prepare? 4 habits. First, drill practice questions until priority decisions are automatic. There is no percentage to scrape past, so do not chase a number. Chase consistency on hard questions, because that is what an adaptive test will hand you. Second, master the language of the question. First, best, initial, priority, most important. One of those words changes the correct answer. And in pharmacology, learn drug classes and their safety checks instead of hundreds of brand names. Third, keep notes on every miss and write down why the right answer was right. Then drill your weak areas, weighted toward management of care and pharmacology. Fourth, run every scenario through one framework. Airway, breathing, circulation first. Then, physical needs before psychosocial ones. Then the nursing process. Assess before you act unless the client is unsafe right now, and keep a steady pace. So remember, 85 to 150 items in 5 hours, adaptive, no percentage score, exam length means nothing, and the heaviest areas are management of care and pharmacology. Pass it by drilling clinical judgment, not memorized facts. Start now with free NCLEX-RN practice questions at .com/en/NCLEX. Free, in English, Chinese, and Spanish with no sign-up.